Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network, joined with Adam Thacker today, who's our Chief Operating Officer of Good Samaritan Hospital. Again, this week we'll be talking about COVID-19 in our local community, talking a little bit about what our numbers are, where we're going with testing, and kind of what the thought process is going forward as we've moved into stage 5, and then what our masking issues are going to be coming up. So just starting off with some local numbers, total cases around 575 since we started, but again, not nearly as important as when we talk about the positivity rate in all individuals and unique individuals. 14% or so on unique individuals and around 3.5% on all individuals over the course of the past week. And really that's the number that you and I keep talking about every week because it really reflects actively what's going on. And we've got around 60 cases active in the community, somewhere in that range. But that positivity rate is what we watch most closely to see if things are going up or coming down. If we look back 4 weeks ago or so, we've come down from them. But if we look over the past 3 weeks or so, we've been pretty stable in the 12 to 14% range.
Yeah. A few weeks ago, I think we hit up in the 19% range. So seeing that significant decline is positive, and that's where we want to continue to see that trend. Early last week, we were down in the upper 12% range. So we really that 12 to 14% for the unique individual. And as Dr. Stine mentioned, the active cases, so the 60 active individuals, those are folks that are quarantined at home, recovering. So everything still is in place for being cognizant of your surroundings, social distancing, following our hand hygiene practices. What you've probably heard on a national scale is we're moving into a colder season and fall that we're starting to see increase in cases. But keep in mind, what remains to be true is 80% are recovering at home, not requiring hospitalization, which will be really important as we move forward because we talk a lot about resources and what that looks like at a healthcare standpoint. And so we're happy to report that our numbers at Good Samaritan remain very low as far as our resources being able to take care of those patients that are in need of that higher level of care.
And regionally, that's watched as well. When we look from a state standpoint and also from a district standpoint, ourselves, our hospitals to the south, we look at those numbers very carefully to make sure that we've got enough beds available and ventilators available and so forth. And thankfully, that's never really been an issue, even as we've seen those numbers increase over the past month or two. And as Adam said, we really see the full gamut of this disease process from people who have virtually no symptoms whatsoever, who get tested and found to be positive, to those that require hospitalization, and then a very few that require ventilatory support as well. But we want people to be very conscious as we go over these next few weeks or so because, as you know, so many illnesses come around this time of year naturally anyway. You and I both have young children, and they're little vectors to bring that stuff home. But interestingly enough, we've been very fortunate that in our local schools, they've been excellent as far as masking and hygiene and control of the situation. So we've seen very low numbers in the local schools.
Yeah, and I think as you and I have discussed offline, we actually expect to see lower numbers of some of the viruses that we're more accustomed to seeing, such as influenza, because our infection prevention practices as a county, as a region, as a nation have improved dramatically due to coronavirus coming about. So as we see that, it still remains to be seen exactly what the fall will look like. But as things move more indoors, we're going to have to be aware of our surroundings and those situations. And schools have done an excellent job. There is now a school dashboard on the ISDH coronavirus dashboard that you're able to look specifically at the counties by schools. And Knox County looks really good. And that is because work they did up front to have plans in place to be able to have on-site school and be able to move in that direction. And really have been very fortunate at the number of cases that we've seen. There have been some, and that's to be expected, but have seen really low numbers.
And a lot of people are sort of surprised by that, but I think if we look at our schools, the schools are very regimented.
Right. Teachers
are very regimented. The students are very regimented. And so when they're told this is the way things are going to be done in schools, that's how they do them. Yeah. And they did have a very good plan going into it. And so that's why we've been very fortunate and had very low numbers of cases. As we move over the next few weeks or so, we have the presumable mask mandate end coming up. And as you and I have discussed, even though we've entered into stage 5, I think we all believe and probably are somewhat hopeful that mask mandate continues. And it's funny to say that because we're all sick of masks, but we know that it's helping. And we know that regionally, when we look at District 10 where we are, our numbers have gone up and they're not the same as what the rest of the state has seen.
Sure. Yeah, and as we've talked about, absent a widespread vaccine rollout plan, which we'll probably talk more about at the end, masks are our number one protection as long as everybody is following the mask mandate. That helps to protect transmission of the illness. And what we saw with moving to stage 5, I think there was an initial, stage 5 means back to normal. But the mask mandate remains in place even as things are opening up. And certainly when we look not just statewide but at our region, we've seen some higher numbers than what the statewide numbers are reported. So that masking is really important. October 17th is that date that is set for that to be reviewed again. But what we've seen is that keeps moving along, and that really will continue to be the case as we move forward, that will continue to be pushed out. I think from a leader standpoint, Governor Holcomb, they're setting those dates to then readdress it, but we fully expect that to go into next year. And really something that even if that were to be removed at a state level, I think regionally we would have to look at that with our health leaders and say, is that appropriate for District 10, Southwest Indiana?
Absolutely. And as we look forward also, you'd mentioned vaccinations and when those things become available. The flu vaccine is available, has been for about 4 weeks. We are seeing that high-dose flu is not as available as what we would like it to be. So for our population that's over 65, please be patient. We have patients in the office every day that are asking us if the high-dose flu has come in, and it seems to be delayed, although we have gotten ample quantities of regular flu vaccine that has come in. And we've got a plan coming up in the near future for mass vaccination for ourselves and also availability in the community. You'd like to talk about that?
Yeah, and we've had a couple of vaccine days or vaccination days for our pediatric population. As of late last week, we were just shy of 400 of the pediatric population had already been vaccinated. As we move forward, we have on October 13th that we are doing a mass vaccination for our employees, and that's really a twofold. It's a single day effort to vaccinate as many of our employees, which that is a mandatory requirement that we follow every year. This year is no different. Typically, we've spread that out more. This year, we're using that as a training avenue to be able to do that in a single day and see what those processes look like. And then following that, October 14th through the 20th, we'll have community clinic drive-through style influenza vaccination for our adult population. As Dr. Stine mentioned, that will be the standard dose influenza vaccine. And the high dose, we're still working to get that in for that population that is over the age of 65. So that is worked through your primary care provider. And as that becomes available, we'll roll out additional efforts to get that out to everyone. But whether it's a Good Sam clinic, whether it is a local pharmacy, there are many other places that are offering. I think our big push is get the influenza vaccine, get it early. We're looking at a month in advance that we're going to see that convergence of flu starting to pick up, and COVID's still going to be here, so we really want to push those vaccination plans.
And we've been encouraging people since the vaccine came out about a month ago to go ahead and get vaccinated. There really, truly is no such thing as getting vaccinated too early for influenza. So we would encourage everybody to do that now. A lot of questions come up on a daily basis as far as if I get any type of respiratory symptoms, what do I do? And we have several things in place to deal with that. Obviously, our phone line to call in to do initial triage of that is what most people would initially choose to do. However, we really sometimes have to step that up when patients have more developed symptoms, more respiratory symptoms, fever, things like that. And we encourage everybody to get in to see their primary care physician, because it's at that point we really have to talk about whether additional testing is necessary, whether treatment for other conditions is necessary, because as we're seeing more of those viral illnesses come up, we're still seeing all the allergy things going on. We're about midway through harvest right now, and of course anybody who has allergy or asthma problems are flared up right now, and we anticipate that's going to continue at least until we get through a few good frosts and a little bit more rain to kind of bat everything down. But as we talk about testing, Adam, would you talk a little bit about what testing we have available and why we're doing what we're doing?
Sure. So the triage line, I'll just mention the 812-885-3331. If you're starting to have that initial onset of symptoms, but don't need to go to a provider or testing site or have questions about where to go, that's the number to call. We can add that to the Facebook message so that you can see that, and it's on our website, of course. If you don't have a primary care provider, they can help to set you up with finding a provider, getting established, something that we would recommend regardless of the COVID situation. As far as testing, if you are experiencing symptoms that need assessed by a provider, our convenient care out of Willow Plaza is providing that. We have providers there as well as testing capability in partnership with the Knox County Health Department. We have at our medical center of Vincennes, where our largest primary care base is, a separate testing site. And we talk with testing and immediately we think coronavirus testing, but we're also, from a differential standpoint, testing for influenza now that we're moving into that season. It may be strep. There's additional testing capabilities to help to identify what virus you may have contracted and what the treatment regimen would be, and then moving forward. So those are the two main testing sites that we have set up in the county. And then certainly anybody that is experiencing significant distress, shortness of breath, our emergency room and our acute setting here at the hospital also has all of the testing capabilities. But that 80+% that are ambulatory in the community, convenient care out on Willow, or medical center on First Street would be the avenues to go to. We remain using the swabbing technique, nasopharyngeal, or the NAIRS, the nostril swabbing. We talk a lot about antigen testing, saliva testing, point of care. We continue to follow CDC guidance on what that gold standard is for testing accuracy, that specificity and sensitivity of if the virus is present, we'll identify it. Our lab team pretty much daily is looking at what new tests come out and get FDA approval, and if they make sense to move in that direction. We are hopeful that a point of care flu and coronavirus test will be available soon. We know that there are works on making that happen, but there hasn't been anything approved to date that we would feel comfortable in using.
Yeah, and our plan is to continue to stick with that until we can see something that from a statistical standpoint looks better and we can make better decisions off of. As we move forward, also, we get a lot of questions, and especially since President Trump has recently tested positive, about treatments and what is out there and if there's something new. We had heard over the weekend that he had been administered some experimental medication that was essentially an antibody to help his immune system fight that off. That is certainly not mainstream by any means, and it's a company that's developed that along with a variety of passive immunity type vaccines in the past for other illnesses. So it's something that we'll hear more about, especially because it's affecting our president, but it's not something that by any means is mainstream. And as Adam suggested, the main thing that we see is the majority of patients don't require any treatment whatsoever. Right. And the patients that do require treatment, the majority of that come into the hospital is still basically just supportive care and supportive respiratory care as well.
And one of the questions that I've gotten frequently is, Good Samaritan Regional Hospital, do you have access to all of those treatment modalities? And the answer is yes. All of those FDA-approved treatments, convalescence plasma, you hear about remdesivir, antiviral, steroid treatments. I mean, those have been used for eons, even before COVID. All of those treatments are being used, and we follow best practices, and there's been a widespread sharing across the health system of what practices work and what practices maybe don't work as well. And so those are all available to our patients that do require hospitalization, absent a few of the research studies that the president was receiving. Those are not available in any hospital.
Right. And same thing is true as far as ventilatory support. We've been very fortunate that we have had a good supply of ventilators from the very beginning. The other thing that has been very unique is our engineering folks have managed to make nearly the entire hospital negative pressure back, or actually early March and April. And so the fortunate thing is that helps keep all of us safe, that helps keep the rest of our patients safe. And then all the modalities as far as providing respiratory support that you would do at a larger hospital, we do here at our regional center as well, as far as how the ventilators are used, proning, bronchoscopy to open up the airways, all of that is something that we utilize as well. So as we move forward, we'll keep you informed of any new treatments that are being approved. But as you hear about these other things in the news, we're watching as well to see what the availability of those things will be, how they're being tested, and how effective they're being. And as Adam said, one of the things that's really been amazing about this from the beginning is countries around the world are doing all of these research studies in parallel and helping each other out. And so as we are waiting for the final phases of the vaccine studies to be done, there are other companies like the one that has this passive immunity antibody to be administered that are also developing studies that are being released nearly weekly. So as we move forward, everybody wonders about the vaccine. What's coming and when is it coming? And the answer is we don't know, but we know that the thought process is that we need to be prepared, and we're told to be prepared by the end of October, essentially.
Right. Yeah, the guidance that was sent out for healthcare systems was to be ready by the end of October for a phased rollout. So when you hear that November 1st or end of October, that doesn't mean that there will be millions and millions of doses ready and everybody will be encouraged to get the vaccine. It's a phased approach, starting with healthcare workers and then moving to the population that we've talked about are at higher risk for having a more difficult time recovering, all the way to the healthiest individuals and the younger populations that are seemingly recovering very easily from this illness when they do contract it. So we continue to look at that, and we have a plan in place. That's part of the influenza vaccination drill that I mentioned and being prepared. We work through storage requirements, all of those details. I actually had a call late last week with Indiana Hospital Association, just preparing as a state for when the vaccine is ready, what that looks like, we don't know all of the details, what vaccine will be approved and how many doses and those types of efforts, but having a framework of a plan in place to be able to move down that road. And so it's something that we feel pretty good about where we're at right now as far as being prepared. There's still a lot of variables that have to go through the approval process before we have all the details.
And then from time zero, when that vaccine starts getting administered, the whole population won't be vaccinated in a month or 2 months or 3 months.
Yeah.
I mean, presumably we're looking at a period of 6 to 12 months from the time the vaccine becomes available for time for administration. And again, that stepwise process of our greatest and most at-risk population getting vaccinated first and then stepping down from there.
Yeah, the CDC director was quoted a couple of weeks ago as saying the general population would be looking at having a COVID vaccine available next summer of 2021. So that phased approach, certainly isn't a 1 month, 2 month, 3 month. It's spread out over the course of probably a year.
Any other things before we go to the phones?
The only other thing that I would mention is we've talked about visitation most of our weeks that we've been on here, and there have not been any further changes. We've continued to look at those processes, but still one visitor allowed with our patients and coming in, whether that's in the medical office, ambulatory, a testing site, as well as on the inpatient. Certainly there are some exceptions to that that we're working with families on, have really improved communication with families when they're not able to be on site and with that designated care provider. So at this time, we'd say if you have a loved one going into the hospital, having a designated care provider and having a plan certainly aids in our communication being able to be dispersed out to the rest of the family. I will say it also is something that our District 10, the Community Patient Safety Coalition, which is made up of the Southwest Indiana hospitals, is continually looking at visitation, and as we move into the fall, it is highly likely that we'll have to continue to look at that and what's the safest route for not only the population but also for our team that has to stay healthy to be able to take care of everybody. So we're continuing to look at that, but no changes at this time.
Okay. Tiffany, questions from our viewers?
The question that I have now is about the Pediatric Clinic. So I guess the children have to be a pediatrics clinic patient, or can it be a child that sees one of the Good Samaritan family practice doctors? Can they go to that, or should they go to the doctor to get that shot?
Sure. Right now, the Pediatric Clinic is for the MCV pediatric patient population that's open to. We are looking at being able to add additional days for pediatric clinics. Drive-through is a little bit difficult, so the drive-through that I mentioned is the adult population, but we'll likely be adding days to that. So if you have pediatric age children that are not part of the MCV pediatric office, contact your primary care family medicine physician and talk about options to get the vaccine, which may be coming into their practice, or they may be able to direct you to other avenues to get the vaccine.
Yeah, and we've been vaccinating patients in our clinic for the past 3 or 4 weeks or so, so we will continue to do that.
Looks like that's all there is today.
Well, okay. Nobody woke up and drank their coffee early. Well, thank you all very much for joining us. Adam and I will be with you again in a week or so to discuss current status of COVID in our community. And everybody, please stay safe, continue to mask, and do your good normal hand hygiene. Thank you.